Patrice, Vance, Platinum out of sunny California. And I'm so excited for our second series of Special Disability Travel with Patrice, Vance, and the team. So today, our agenda is going to be categories of special needs: medical disabilities, mental disabilities, and physical disabilities. And the reason why I'm doing this in series so those who's learning and saying that they truly want to do this really understand what are the different categories when it comes to special disabilities. And then next week, or when I will share who's going to be training next week, we'll probably train on something totally different. But when I train, I'm going to be training on phases of special disabilities. So we're going to talk a little bit about today medical disabilities. And medical disabilities is a broad term that can encompass of many different conditions, illness, and injuries. Here is some of the information on a few of the common disabilities. Cerebral palsy. Cerebral palsy is a group of neurologist disorder that affected movement and coordination. And it is caused by a damage to the brain that occurs before, during, or shortly after birth. Symptoms can range from mild to severe and include muscles, weakness, spasm, difficulty, and motor skills, and trouble in balance and coordination. And I could talk to a little bit of this because I have one of my cheerleaders. She's 34. She's wheelchair bound. And she's the most outgoing individual that I have ever met. And when you find yourself, and I know that some of you probably have family members, but when you find yourself wheelchair bound and you're unable to do so many different things, and you're having those challenges with your muscles and your weaknesses, it can become overcompensating, not only for yourself, but with the families. And that's the reason why I really dived into this, because being a foster parent, I have taken care of medical fragile children, and some of them have fell into these different categories. So we have muscular dystrophy. This is a group of a genetic disorder that cause progress, muscle weakness, and degeneration. There are several types of muscle dystrophy, each within the set of symptoms and progress. Common symptoms can include difficulties walking, trouble in balance and coordination, and progress muscle weakness. And I'm going to tell you, on the medical disabilities, this is the cool piece about this, you guys, because you'll be able to get this video, but you guys also can take pictures and shots of all of the presentation. I have someone just inbox me. Okay, we're going to talk about spinal cord injuries. A spinal cord injury occurs when the spinal cord is damaged too severe to result to loss of sensation under movement below the level of the injury. The severe of the spinal cord injury can vary between people experiencing only mild impairment, while others can be completely paralyzed. Symptoms can include loss of movement, sensation, difficult in breathing, bowel and bladder dysfunction. I'm going to tell you, having an opportunity and meeting so many amazing people at the Ability Expo, and you don't really want to ask, what truly is their disability, but just being able to have that conversation with them and talking with them about what they can do with travel, they really, truly, truly open up, family. And I can tell you, I had some families that had me in tears of joy, but just in tears of wow, what they have experienced over their lifetime, and that some people don't have family members like ourselves that's there to help them. Some are placed into facilities, but to be able to see and be able to talk with them and to be able to let them know that they can't travel, just like we can. And by being a specialist, you'll be able to really sit and manage and talk about those things. And we're going to help you guys with that. We're going to put forms together so you can be able to ask those right questions, just like you have a customer profile today. So look at this young man here. Traumatic brain injury. A traumatic brain injury occurs when the brain is damaged as a result to a blow, a joint to the head, or penetrated head injury. Symptoms can range from mild to severe and can include headaches, dizziness, difficult and balancing and coordination, memory problems and difficulty and communication and language. But you know what? Look at this young man. This is what I love, to see them smiling. They're not allowing everything. You know, we say life getting in the way. Life getting away with everyone. But a lot of these individuals with disabilities does not allow everything to stop them, you know, and retaking the tests on Saturday with one of my business partners, we were listening to the presenters, and the presenters have had the same challenges that everyone in autism is having in their life every day, but they did not allow it to stop them. They're now writers. There's one young lady that's cheering for, I think, for the Eagles football team. There's another one that is a writer. So they have not allowed their disabilities to stop them from living their everyday life. So multiple sclerosis is a autoimmune disorder that affects the central nervous system. Symptoms can include muscle weakness, trouble with the balance and coordination, difficult in walking, sensory problems such as numbness and tingling, and severe progress of symptoms that can be widely between individuals. You know what? This is true. This is something really true. And I'm going to tell you, I'm 65 years old right now, and I'm taking multiple different tests only because I have other health issues. And with my health issues, I can end up with scoliosis. I can end up with a lot of different things. So as we get older, we have to make sure that, one, we're eating right, we're taking care of ourselves. Yes, I'm saying this now, but I can tell you, a year ago, family, I would get on a call and get fussed at because I was not taking my health seriously, literally not taking it seriously. Epilepsy, it is, epilepsy is like a neurological disorder. It's seizures. It's characterized by recurring seizures. Seizures can take different forms, and it ranges severely to mild to life-threatening. Treatments for epilepsy typically involves medication and other therapy controls seizures and manage. So I can share a story with that, because you always have to have a story, right? Or you got to tell a story. My hairstylist over the years have severe recurring seizures to now today, family, she cannot drive. She have had 3 car accidents within the last year and a half. So the Department of Motor Vehicles have taken her license, so she's unable to drive. Not only that she's unable to drive, she just recently moved in with her mom because her seizures had gotten to the point that they're more frequent than others. And granted, she is like 43 years old, and she has been dealing with this now seriously. And first we thought it was her weight, so she kind of went through the weight surgery. She was able to get that down, but it's not. It's something that she's going to have for the rest of her life. And she really has to make sure that she's taking her medication, that she's doing her exercise, that she's doing her therapy to control her seizures, because it is very life-threatening. So you guys probably have family members that have the grandpa seizures. There's so many different seizures, but this is something that's really, 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 all of them are serious, but this here is more serious because sometimes you can have an episode. And like I said, She did have 3 car accidents. 2, she walked away with no scratches. The third one, she was really hurt really bad. So these are a few examples of many different medical disabilities that can affect an individual. And it is important to note that each person's experience with a disability can be unique, and many required individual support and accommodations. So this is what happens when you are fact finding. When I say fact finding, you might say, well, why would you say fact finding? Well, when you're really writing out your customer profile, and when you're really working with a family, you have to ask those questions. It might be uncomfortable, but it's kind of ironic in the training this past weekend, it kind of share with you on how you say and what to say when you're talking about their disabilities. So we're hoping to be able to get some of the trainers be able to kind of pull some of that together so you know exactly, because I learned that you don't say special needs. I learned that at the Ability Expo last year in Los Angeles and New Jersey, that you don't say special needs, you always say that it's special disabilities, because then they really talk about it. And someone had to pull me aside and say, you don't say special needs, Patrice, you say special disabilities. And I guarantee you, your approach is going to come across a little bit better. So I learned something, family. So we don't say special, we say special needs as an agent, but it's special disabilities. So we're going to talk a little bit about mental disabilities. And mental disabilities can present unique challenges for individuals who want to travel. However, the travel options for resources available for people with mental disabilities to ensure that they are safe and able and enjoyable travel experience. And here are some of the common disabilities and resources available for the special needs. This is something, family, that is really, really, really dear to my heart. As I stated, I've been a foster parent for 40 years. And in those 40 years, the majority of the children I have taken has been medical, but majority of them have been more of the mental disabilities. And when I think about the mental disabilities, I have taken care of all age children, but probably the last 20 years, I focused on at-risk teenage girls that have been in a group setting, group home setting, and then transitioned to home. And I can tell you, those that know me, know my household living every day is always something. But what I've learned is if they can walk away and learn one thing on how they can survive into the world, I've done everything I possibly can. So let's just talk a little bit about autism spectrum disorder, and that's ASD. And I am a parent of an ASD child. And she has a spectrum of autism. And Autism of the Seas is a travel agency that specializes in providing cruise vacation for individuals, the family with special needs, including autism. And they offer a range of travel services, including specialized programs, accommodations, one-on-one support, and individuals with autism. We're really going to dive into Autism of the Seas because they have a way that you can partner with them. They have a way that you can be an affiliate. And they also have a way that you can be a travel agent and still get paid through Archer or get paid direct. So we're going to talk about that. I have how that outlined. I think that's probably and probably like next month sometime, but you most definitely are going to learn who are those vendors out there, how you can partner with them, if you can become a travel agent with them. So we're going to talk to those things. All right. So we're going to talk about ADHD. All of my foster children are ADHD. Some of them are ODD, optional defiant disorder. There are so many things. This piece here, I always tell the county social worker and the therapist and the med doctor, do you guys really know? I probably can do you guys' job. Don't have the degree, But I most definitely could probably sit here and tell you everything you probably want to know about every last one of the kids that have been in my home. They have some of these disabilities. So the attention deficit hyperactivity disorder, ADHD, traveling with ADHD can be challenging due to difficulties in attention impulse control. To make the travel easy for individuals with ADHD, maybe benefit in planning ahead. Absolutely, those know me. I have to plan always ahead. Creating a schedule or an itinerary, using medication, and other strategies of symptoms. Some airlines and hotels also offer accommodation for individuals with ADHD, such as priority boarding and quiet rooms. This is not just for children. This is for adults. I know some adult individuals that are ADHD, and this is really serious. And because I have worked with the children and as children till they turn 18, and then some still stay in my home until they're 21. I've been lucky to have one that stayed in my home until they were 25. And 9 times out of 10, I either have a conservatorship or guardianship all the way up to the 18. And when they're getting ready to turn 18, then I would transition over to conservatorship. But you know what? They need people like ourselves. But the exciting piece is not just for travel, they also get that same nurturing. That's where Sherilyn Wooby's going to really be able to talk about the education portion of it. And there are some other business partners that are in education, that are nurses, that have shared that they really like to be part of the team. And we're going to get as many as experts to be a part of our training team to be able to share with you guys all up in everything. We're not going to say we experts in this. I can tell you, I've been doing this for a long time, and I just retired and bringing in any other foster kids in my home about 2 years ago. I still have a foster daughter in my home. She's 15. She's in the ED setting. And what that means is she's in the emotional disturbed setting in school. She's not in district. So because she has so many of these challenges, we'll be able to talk about those things soon. So mental disabilities can present unique challenges with individual who wants to travel. However, there are options and resources available for people with mental disabilities in safe environment. And I think I just did this. Here are some of the most common disabilities. I think we talked about this. Oh, okay. Anxiety disorder. Some of us have that. I don't even know it. I hear from some of my business partners when things happen in their life. Anxiety disorder, traveling can be stressful for individuals with anxiety disorder. To reduce stress, individuals may benefit from planning ahead, practicing relaxation techniques, seeking out accommodations such as quiet rooms, or access to emotional support animals, which is going to be really exciting because next month on the 12th, we have one of our trainers, Tanya, that's going to be talking about service animals, service dogs, and we're going to have a guest speaker that's going to be able from the ADA that's going to be able to talk a little bit more about that. There are some other, again, there are so many people that reach out to me that have so many amazing things that they want to share with us. Some airlines offer special services for individuals with anxiety, such as priority boarding and options to purchase an empty seat next to them. This is where you're going to be asking these questions. You're going to have to know, and the family's going to have to share, because when you're booking their travel and you have to book on steps, we're going to talk about what steps is, when you have to work directly with the TSA to let them know there are passes and ID cards to let them know about your special disability clients that are traveling. We're going to talk about those things too. Depression. Wow. Depression can hit anyone, not just a mental disability. Depression, individuals with depression may struggle with stress of travel and being away from others' support systems. To make it easier, to make the travel easier, individuals benefit from practicing self-care techniques. We're most definitely going to get someone to get on and share with us on self-care. such as medication, meditation, exercising, or therapy. Some hotels offer wellness programs and mental services and mental health resources. So again, as a travel agent working with special disability industry or that client, it's gonna be more than what we would normally do and just booking a regular booking, a booking a group, and groups can be challenging too, but it's going to take that person. So if you're really thinking about doing this niche, if this is going to be your niche, you're probably going to make this a priority, and some of your other travel is going to come secondary, but that's going to be a decision that you will have to make. Overall, it's important for individuals with mental disabilities to plan ahead, seek out resources that can help them have a safe and enjoyable travel experience. This includes specialized travel agency, accommodations, and all of the other catered to unique needs. So that is your mental disability. So now we're going to talk about a little bit about the physical disability. Family, I didn't go into all of disabilities. What I was trying to do is get enough to get your arms around, wow, is this something I really want to do? So now we talked about medical disabilities and we talked about the mental piece of the disability. And that mental piece is some that is not just for the children, but it's for adults because it's also happening in the school setting. So kind of what they're doing with us for the travel is similar to what they actually do on that one-on-one in that school setting. So physical disabilities can present unique challenges for individuals who want to travel, but their travel options and resources available for people with physical disability to ensure that they have a safe environment travel. That's what we're saying with medical and mental. Here are some of the most common physical disabilities and resources that are available for a special needs travel. Mobility impairment. An individual with mobility impairment may benefit from using a travel agency that specializes in accessible travel. And we'll be talking about a lot of accessible travel. We know that SNG, Special Needs Group, is one of our accessible travel companies. And we know that such as World the Wheels is an agency that helps arrange accessible transportation, accommodation, equipment rental, such as wheelchair scooters. Airlines also offer accommodations for individuals with mobility impairments, such as priority boarding, sitting, and extra. Well, of course, when you're booking that with the plane, they're going to ask you for special accommodations. I get special accommodations. You guys, I can't walk long distance. I can't walk long distance because I have COPD with emphysema. Never smoked in my life, but I have it. And they said it was probably from secondhand smoke or probably being exposed to asbestos because of the type of work that I was doing prior to coming to Evolution. So it's so many different things, but they have it all outlined there for you, and they will work with you and they will work with your client. So that's the exciting piece when we really started diving into the TSA portion and the steps for special needs. Visual impairment. Individual with visual impairment may benefit from seeking out for destination and accommodations that are specifically designed for accessibility. Some hotels offer accommodations such as Braille signage and auto description services. Travel agencies can also assist transportation and itinerary planning. This is going to be an exciting piece because right now I'm looking for travel companies that's already planned in this market and reach out to see if they're open to come and just kind of share their experience with us. We want to learn everything. We want testimonies. We want people that are experienced to talk to what we're trying to do here so we can learn. I always believe if we learn one thing or take one thing, take away from any training, then I have accomplished everything that I possibly want. So sign. Hearing impairment. Individual with hearing impairment may benefit from using a travel agency and accommodations and offer specialized services to deaf and hard hearing, such as American Sign Language, ASCL, interpretation services, and airlines that offer visual alert systems and captured in-flight entertainment. Well, I do have a few family members. I was raised up with my cousins, two that were deaf, and we was enough to sign to be dangerous. We got signed and got a hand spanked because, sometimes you sign and they say they're not supposed to be signing. But she is now, she's about 4 years older than I am. She's about 69. She have had 4 children. She had taught all her children how to sign language. All of her children are able to hear. She have grandchildren. So it have not stopped individuals with hearing impairments stop living. Again, we all have something that goes on in our life. These individuals have something that goes on in their life every day, but they have not allowed it to stop them from living. So we can also provide service for them also. So neurological impairment. Individual with neurological impairments such as cerebral palsy, we talked about it, multiple sclerosis, and difference from using a travel agent that specializes in accessible travel. This is a thing. We are going to be able to book accessible services for these clients. And sometimes we might not have it with Archer. We might have to go out and look for our clients. And it's what's going to set you aside. You might have to go out. You might be able to book everything from the hotel to the air to everything through Archer. But it might be a piece that SNG might not have. It might be a piece that Worlds on the Wheels might not have. But what I can tell you is we have a list of that's going to be phase 5. I've been working on that. I think my virtual assistant's probably like, oh my God, Patrice, if you send me anything else over Mother's Day weekend, I'm going to scream. But I went in and I dived in and I pulled and I extract as much as information that we can give you guys to help you be successful in this market. So all I'm saying is really, truly think about this. And if you guys are ready, we're going to learn together. And this is what we have to do. Ask questions in that Facebook page. Don't just be sitting there on the Facebook page waiting to see what's going to be posted next. If there's something that you want to learn, if there's something that's important to you, drop it in there so we can have conversation. We have over 72 individuals that's in the page. We've always had about 35 that's been there since 2019. And I just did a roll call and says, hey, if you're in here and you're active, go on and let us know, because we want to make sure that we got the right audience and that we're going to be pouring into each and every one of you to get you all of whatever you need. You can always reach out to Stacy, where Deidre, Tanya, all of those ladies are going to be here training. If it's anything, drop it inside that group, ask us, and we'll be able to take care of you guys. So let's say overall, it's important for individuals with physical disabilities to plan ahead, seek out resources that can help them have a safe, enjoyable travel experience. This includes specialized travel agency accommodation and other services that are unique. So there are going to be some other services that we might not have with Archer, that we might have to reach out to others. There is a group that Tanya and I are going to be working with and bringing them to this special needs group. I just need to go in and do my registration portion and everything so we can get the ball rolling. But there are suppliers out there that want to work with us that's just strictly doing accessible travel. So I know that we're trying to keep it under, but we're going to do, I'm so sorry, you guys, we're going to do some questions and answers. And I don't know if you guys are dropping anything inside the chat box. I know that we got the trainers out there that's helping. I know we got Adrian that gracefully says, I'm going to facilitate and be your co-host here with you today. So ladies, I don't know if there's anything in the chat box. If anybody want to raise a hand, if you have any questions.
We've been answering them in the chat as they've come up.
Thank you, thank you, thank you.
I do have a question. Are we going to be doing some specialized training on support animals and that kind of area?
Absolutely. Actually, support animals for the support dogs is going to be, and we're going to look at support animals, but I know that on June 12th, we are going to have Tanya from Central Florida. She will be presenting and training on service dogs, but we are taking all that piece and what you just asked. We are going to be looking into that. I'll be having a conversation. I'm trying to put together a team call with the trainers, and there are a couple of other individuals that I want to bring on, but I want to be able to have a conversation so we can make sure that it's going to be a great fit for us. But yes, so, and this is the thing, Alicia, sign up in the group. You guys drop inside that special needs Facebook page, stuff that you guys like for us to train on. There's a possibility, we already have it outlined for you. We just kind of do it. My segments are going to be done in phases. So I'm not here next week, so you won't get my presentation, but you'll most definitely get a presentation from our guest trainer next week will be Stacy. We're out of Las Vegas. So we'll be getting with her, find out what she's going to be presenting, and she'll be on next Monday. And what we'll do is we'll be dropping her picture on the flyer that we'll be promoting next Monday to make sure that you guys are on. But we have a bunch of stuff that we're going to be doing, and we have multiple trainers that's going to be training.
I do have a quick question.
Sure.
I am certified with SNG. Do I need to get certified with this as well?
Well, this here, what you guys are doing, we're not getting certified on here. What I'm doing for you, Lily, is providing you guys with content and information.
Got it. I missed last week.
To be the best special disability travel agent in the universe.
Okay, that's what I want to be.
That's what we're going to be doing. We're going to give you
this
tools.
Is my niche. So
this will be tools. But we are, when I get back, the next piece will be on the certifications that you can take. So you can have it under your belt. Because I'm going to tell you a secret. When you go and take the autism training, the IBCE, what is it? IBCESS. I should know it because I was on it the other day. They asked for all of your certifications. So I just went in, updated my stuff, but I have not uploaded my certifications. But the goal is, if the certifications right now for them, if you are registered for Sandals, you can register and take the test and pay $75 versus $150. But we're going to talk about that next week.
Okay.
We got the next. When I get back on, I think the 5th, I think I'm going to be talking about that. We're going to go through all of the different certifications that you can take to be certified.
Okay, perfect. Awesome. Thank you.
I want you guys to be the best of the best.
I'm excited.
Thank you. Now, you inbox. Did you inbox me? I've had so many people inbox me. I can't remember.
I did not.
Okay.
I did not. No, I did not.
That's okay. So have you registered for the Facebook group?
I did. I just registered.
Okay, great. We'll be getting in there and I'm going to ready assign the trainers admin, so we make sure that we're able to get everybody in, and that's what we want to do. We want to be able to give you guys the tools to get out there, not be afraid. I'm going to tell you, I was afraid, but I had to learn, and once I learned, and to be able to work with these kids over the last 40 years as a foster parent. I have only, anyone that knows me later, they will tell you, I have only worked with, medical, just all 3 of them. And that's my passion.
Well, I've worked with special needs kids. They were actually adults, but they were like children. So that's where my heart is, like, oh, they need to travel. They need,
Yes.
they want to. So that's why I was so excited for this. I missed last Monday.
That's
Um,
okay. We're going to be dropping both of the videos today.
Okay,
So
great.
you'll be able to listen to, and last week was talking about what a special needs travel is, becoming a special needs travel agent, and what is a special needs travel agent? Because
Okay.
people really need to know, because again, we had over 100+ people last week.
Right. So it'll be
We had
posted on
70.
the page. Is that the
Yeah,
Facebook page? Okay, great.
yeah, so
I'll catch up
so we
then.
will be posting both of the recordings today.
Okay, wonderful. Thank you. That was
We're
my
gonna be
only
posting them
question
every
for you.
Monday.
That was my only question for you. So
Sure.
sorry to take up time.
That's okay.
I'll mute myself.
That's okay. Ask your questions away.
All
Thanks.
right, Patrice,
Patrice?
Yes.
this is Michelle. Can you hear me?
Hi, Michelle. Hi, Michelle.
I was the one that sent the message. So the people have wanted me to set a meeting up with them to start the training. So should I wait until we go through your training on the 5th? And then go
No,
through beaches or?
I want you to go on and do your trainings. When you get your trainings completed, drop it inside the special needs page so we can congratulate you and we can keep track on what you guys are doing. You don't have to wait until what we're going to be doing that's coming up in a couple of weeks. You can still go on and take your training. I went on and I renewed mine because I was supposed to do it last month, but as we say, life got in the way. So I just went and taken care of it just the other day.
And you said it would be discounted if we do it through Sandals. You'll tell us how
Okay,
to do
so what
that.
you're going to do is, are you registered for Sandals right now?
Next month, I will be 6 months. So
Okay.
then I'll be able to at that
So
point.
then you'll be able to, and what I'm going to do is I'm going to post and pin it, the discount code. The discount code is Beaches 2023. So soon as you get registered for Sandals, then you can go in and you can take the test. Now you can take the test now, but why pay $150 when you can use your discount from Beaches and get it for $75?
Okay, perfect. Yeah,
And
so
it'd be
I was
good
the one
up
that
until
wrote you
December.
while you were gone. So I just wanted to say, yeah, it was me.
Okay, so you'll be able to do it. The discount code is good until December 2023.
All
Beaches
right, perfect.
2023 is the discount code.
Got it. And then also I put in the chat box, if anybody sees the comment, there is something that was, because I work in the school systems, like I told you, there is a website that you can take free sign language classes on. So that's in the
All
chat
right,
box.
would you like to drop that inside the Sunrise, Sunrise page, I'm thinking about Sunrise page. We like to drop that into the special needs page?
Sure, I
might
can
be
do that
someone
too.
that's willing to do that. All right, thank you so much, Michelle. Totally appreciate it.
No problem. All right.
Patrice?
Yes.
Hello, Patrice. This is Deidre. And I wanted to, just for the good of the group, because I know we've had people logging in at different points in time and asking questions. Our group is informational, and we want to make sure that we're providing as much information as we can. But we do ask that you also be patient with the process, because we do have a calendar and we're coming up with a way of rolling out all the information, because it's too much to try and cover all at once, and it can't be covered in any one call. So when we give out our schedule of what we're training on a particular day, if we can focus on that during that call, so that, because we're also recording these and posting them, we want to make sure that we're able to keep the continuity of which topics we're talking about at what time. If you have other questions, you can always post them to the Facebook group and things like that. But we do want to make sure that we allow the time frame to not get away from us with a lot of questions that are something that we're going to perhaps cover on another scheduled call and things like that. So just be patient with us. We're brand new. And as we're rolling it out, like I said, we'll get that schedule to you Again, if you're taking trainings and participating in other things, that is wonderful. Absolutely continue to do that. And if there are things that are open to the public or in-person things or regional things, feel free to post those in the Facebook group so that others can take advantage of them as well. Because again, we want to be a resource and a tool, but we're not replacing any of those other trainings or certifications or things that are available to you.
Thank you. Thank you. Thank you. Okay, any other questions?
I have a question, Lady Patrice. It's Paula from Boston. I can't raise my hand for some reason on my phone.
That's okay.
I did ask it in the chat, but my question was, is senior travel under special needs travel as well? Does it fall under that umbrella?
For seniors that have disabilities?
Just seniors, well, you know, they have ambulatory issues and not necessarily a disability as far as like not anything that's listed, but they could have arthritis or things of those natures.
Absolutely. We're going to talk about those things.
Okay, thank you very much.
Guys,
I
think
appreciate
about
you.
when I think about that, I think about myself. I have respiratory. Yeah, you know, I'm not truly disabled, but I do have respiratory challenges. So that allows me not to do so many different things. So most definitely, we talked about that last year on the Sunrise call. We're going to be pulling some things together, as Deidre said. So most definitely, we're working. It's work in progress, and we're excited that we're getting as close as we are. Any other questions? Well, if we don't have any more questions, I'd like to personally thank each and every one of you for taking the time out of your busy schedule to get on today for our special needs travel. We'd like to tell you, yes.
Miss Patrice, can you hear me?
Yes, I can hear you.
I'm Stacy. I got a question. So are your, like our get-togethers here, are they going to be done every Monday?
Every
Except for
Monday.
next week?
Yes.
Cool. So
Every
good.
Monday. And there will be someone different. Like next week, we are going to have Stacy of our Las Vegas market. I'm going to tell you, she is a fresh air. She just keeps me so like, wow, I want to be like her when I grow up. But she will be here with you guys on Monday, the 22nd. I am going to be posting the flyer with her picture and all of her information. And I tell you that she is going to knock it out the window. And we are going to record it. So we have about like 4 trainers right now. We're going to probably be adding maybe 4 or 5 additional trainers, and we'll be rotating. So you'll be learning something
test
different.
next week too. We'll have a test next week. Just kidding.
You have a test next week?
Oh,
No,
I
at the
was
end of the
gonna say,
training, we're gonna have a
seriously,
test.
you have
No, we're not doing any testing. This is just information only to have you be the best special disability travel agent that you can be. We're going to give you the tools.
And do you know what Miss Stacy's topic will be next Monday?
No, the team and I are going to be together. We have a different topic every week, and the answer to you is no. We're going to be meeting this week so we can get our calendar together, but it's going to be something different every week. So we just tell everybody you need to just get on and join us.
Okay, and it'll be at the same time, just with
Same
different
time,
people?
yeah, 1 o'clock on the same Zoom.
Okay, all right. Thank you, Miss Patrice. Have a good
So
day.
welcome, Stacy. All right, any other questions? Well, family, I'm going to tell you guys, thank you again so much for taking your time out of your busy schedule. We're so excited, and we're looking forward to seeing you guys next week on the same Zoom, 350-350-2350 at 1 p.m. Pacific. And Stacy, we're out of Las Vegas market will be training. You guys have a amazing and blessed day. Thank you.